Dear colleagues, dear partners, hello, bonjour, grüezi, buongiorno. We at the Data Science Competence Center of the Swiss Federal Statistical Office are very happy to welcome you to our webinar series called Data Science and AI for Public Good. My name is Christine Johansson-Baker. I head the Competence Network for AI at the FSO, and I will be your moderator today. If you wish to submit questions to the speakers, please use the Mentimeter link that you got in the email invitation, or that you can also find in the footer in the description below this YouTube live streaming. So as speakers today, we're thrilled to have Dr. Lucas Henneman and Dr. Corwin Zigler with us for their webinar entitled Environmental Health Data Science for Air Pollution Regulation. Dr. Henneman is an assistant professor of environmental engineering at George Mason University. His research interests include quantifying environmental and health benefits of regulatory policies. He received the Rosenblatt New Investigator Award from the Health Effects Institute. Dr. Zigler is an associate professor of statistics and data science at the University of Texas at Austin. He specializes in the development of data science methodology for causal inference, with particular focus on environmental health and air quality regulation. He is an elected fellow of the American Statistical Association, a founding member of the Center for Health and Environment, Education and Research at the University of Texas, and very important in our context today, a former member of the US Environmental Protection Agency Clean Air Scientific Advisory Committee Particular Matter Panel. And a week ago, about Dr. Henneman and Zigler and other co-authors published a paper in the journal Science, Mortality Risk from United States Coal Electricity Generation. I think this article got a lot of attention. It was seen in the New York Times, Newsweek, and even on this side of the Atlantic in The Guardian. So we feel very honored that you have found the time to be with us today, and also because it is awfully early in the day for you. You are even in the two different time zones in the US. Thank you very much. So we're looking forward to your presentation that I think we can see as something of a textbook example of the policy cycle in action. Without further ado, the floor is yours, Corey. Thank you.
Thank you. I'll share my screen here. Let me make sure we're good here. Just a couple more clicks. All right. Well, thank you for that introduction. It's really a pleasure to be here and have the chance to share some of our work with a group like this. So as Kristen mentioned, Lucas and I will talk today about really a program we have going on in environmental health data science for more effective regulation. And these will be environmental regulations in particular. The story that we'd like to tell today is a story in two parts. So you're going to hear from me first, obviously. And my expertise is in statistics and data sciences. And I'll tell you about, really at a high level, the role of data science in air pollution regulation. And so this will be some introductory material about combining a data platform with some atmospheric modeling, with some high performance computing, and with some statistics towards air pollution, informing air pollution regulations. And then in part two of the story, I'll hand it over to Lucas, and he'll talk largely about the paper that Kirsten just mentioned that we had come out, which is, I think, a really great example of what this type of data science perspective can do, which in this case was a new regulatory impact assessment of the health burden of pollution from coal power plants specifically. So with a little bit of, I should say that the moral of the story, at least as I see it, we'd like to impress upon you for today, is that taking a data science framework to these types of problems and thinking about things in terms of data and computation and methodology for data science really did unlock a new framework for regulatory health impact assessment that allowed us to learn something that we didn't know previously about the health impacts of coal, in this case, coal electricity generation. So in terms of background, scientific background, I'll just say that air pollution is bad for you. And I'll more or less leave it at that. But air pollution can mean lots of different things. And so the focus for the talk today will be on fine particulate air pollution, or PM2.5, sometimes this is called. Essentially, these are just very small particles in the air that are small enough to make us sick when we breathe them in. And there's decades of research about how this type of pollution can make us sick. But when Lucas and I started this work, we were not so much interested in how bad pollution was for us. What we really wanted to think about was questions about what can we do about it. And this really feeds into air pollution regulatory questions. And so I have here, just to indicate the scale of the problem here, I have here a table that's lifted from this report that the US federal government put together that is designed to estimate the costs and the benefits of all major federal regulations in the United States. And I've put this up here. So these are estimated costs and benefits in billions of dollars. And I've highlighted down here the row of this table that corresponds to essentially the air pollution regulations. And I've done this because if you look at just the scale here of the costs and the benefits of the regulations in this highlighted row, they completely dwarf the costs and benefits of all of these other areas of federal regulation. I mean, these are by far the most expensive and the most beneficial federal regulations in the US. And so again, this is just to indicate the scale. These are some high stakes regulatory decisions that are being made around air pollution. And so when we got into this, we saw, there was already a lot of science here, and we saw further opportunity for data science development. So I want to try and articulate that opportunity here. So here's a figure. We didn't produce this. This is from the Health Effects Institute. This is sometimes called the chain of accountability. And what we have is this schematic of all of the things that happen between when there's some regulatory action taken up here in the left-hand slide, left-hand part of the slide, and some human health response down here at the bottom. And so, excuse me, so something will happen here in terms of a regulatory decision or some other action to control air pollution up at the top left. That will change what is emitted into the air, and whatever is emitted into the air changes the composition of the ambient air quality, the air quality that's actually out there, which of course will change what humans are exposed to, the dose that they breathe in of that air pollution, and then that change in dose should elicit some human health response. And so this is sort of the cascade of things that we're trying to keep track of when we say we want to know the health benefits associated with some regulatory action taken to control air pollution. And when we started this work, there was a little bit of I'd say the science along this accountability chain was a little bit disjointed. So the way this tended to work scientifically is you had the domains that I'll call atmospheric science, so atmospheric engineering, atmospheric chemistry, things like this. That was really, those were the scientific disciplines that dominated kind of the upper half of this chain. And then down here at the bottom, this is where the statisticians and the epidemiologists live, where they're doing cohort studies to learn about whether pollution is bad for you. And this separation, I think, actually limited the science that could be done in this context. And so what we saw or started to pursue is the use of data, observed data, statistics, and some high-performance computing to essentially unite these scientific domains to provide new methods for regulatory health impact assessment. So that's a sort of a high-level goal that we had when we got into this work, which I'll say a little more about. So what are some of the challenges in trying to do that? So there are many, but one of them is that the regulatory interventions that we're interested in here are very complex, or at least the link between when some regulatory intervention occurs and all of the downstream things that have to happen before we get some change in population exposure or change in health is a very complicated and diffuse chain. That's what was indicated on the previous slide. And when we think about that, those chain of events that we're trying to keep track of, some of them have good data to characterize them and some of them don't. And so we have to think about being opportunistic in terms of which methods can be useful at different links in that chain, so to speak. And so as a result of that, there has been a historic reliance and importance on atmospheric and environmental engineering. I mean, these are disciplines that develop these very sophisticated physical models or physical and chemical models for how air pollution forms in the atmosphere. And there has been a historic reliance on these deterministic models to characterize problems of regulatory impact assessment. And so there is this distinction between the physical modeling and data that has been present in this line of research. But then, as with most areas of science, the actual data that are becoming the data available to actually try to address these problems are becoming increasingly rich, right? We have very large scale administrative health databases now. We have satellite remote sensing measuring air pollution, new technology and mobile air pollution monitoring of low-cost sensors. The technology is improving fast, which means the data are improving really fast. And so we have this question of how can we marry all of these complex data with those physical models that come from the more atmospheric engineering disciplines. And another question being, can all of these new types of data, can they actually capture all of the necessary complexity to study these types of problems? I mean, these are the sort of, again, the high level challenges we were trying to confront in doing this work. So I'll shift a little bit to talk here. You focus here on the source of air pollution that we're concerned with today, which is coal power plants. And so I want to make a little bit of a subtle distinction here, which is that our work really is focused on particular sources of the air pollution. So if we back up a little bit, we say when air pollution is regulated, it's usually regulated by its type or its size. For example, in the United States, we have national ambient air quality standards, which set limits on how high the ambient concentration of, say, particulate matter is allowed to be in the air. WHO has similar guidelines all over the world. There are guidelines like this, but they're specified in terms of a type of pollution or a size of pollution. In order to achieve those types of air quality standards, we have to take action at whatever the originating source of that air pollution was, right? We can't stick a vacuum cleaner in the air and just take the pollution out to meet the standards. We have to intervene with regulations on cars or diesel trucks or factories or farming, or in this case, for today, we have to intervene on power plants, which means that to inform the science here, we have to be able to isolate the impacts that are associated with specific sources of those emissions. And this is something that I'd say the more traditional methods of health impact assessment really struggle with. And it's becoming increasingly important because in the US and lots of Europe, as air pollution is getting better and better and better, there needs to be more focus on which particular sources of the air pollution give us the most bang for our buck in terms of alleviating some health burden. So we need to know something about the specific sources of the air pollution. And so that brings us to one major source of air pollution, which we'll talk about today, which is coal power plants. And there's a little bit of a story that I want to outline here for how coal power plants produce so much air pollution, because it's an important part of the methods development and the research that we've done. So coal power plants emit lots of things into the air when they burn coal, but in particular, they emit SO2, sulfur dioxide. So what happens is when that sulfur dioxide is emitted into the atmosphere, it starts to blow around, it starts to move, it starts to react with other things in the atmosphere. And somewhere down the line, it forms into these fine particles that I mentioned at the beginning. And that process is called secondary formation of ambient PM2.5. It's that secondary formation that is associated with the largest health burden of coal power plants. And the fact that this happens over time and space is kind of a main challenge that we had to confront with this research. And so because coal power plants are such a large source of this type of air pollution, there are lots of questions about the health impacts or environmental justice questions associated with the emissions or the pollution from coal power plants specifically. So I have a little cartoon here. And this is meant to indicate when I say the secondary formation of PM2.5 is important because emissions from power plants move. This cartoon to the left here is then to indicate the spatial scale of what we're talking about here. So that red dot in the cartoon is the location of a power plant. And those dots that are moving around the map there all are meant to represent the movement of air that originated at that smokestack of that power plant and then blew around with the wind. So you can see that one power plant in southeastern United States, the air from that power plant, so to speak, is really blowing all over basically the eastern half of the country. And so what that means in terms of trying to do regulatory health impact assessment here is that in principle, if we intervene to regulate, let's say, that red dot, that power plant, in principle, intervening there is going to impact the air that people breathe all over the eastern part of the United States. And this is really what makes it very difficult to track the health benefits of emissions that are specific to power plants or regulations that were enacted to reduce the emissions from those power plants. And this is the type of thing that I alluded to earlier that existing methods for health impact assessment really struggle with. Lucas will say more about this cartoon when he talks. So let's talk a little bit about how the traditional health impact assessment works. So here's our chain of accountability I showed you before, and I mentioned the sort of bifurcated status here where we have atmospheric scientists working on kind of the upper half of the chain, and then the epidemiologists, the statisticians, toxicologists, clinicians working down here in the lower half. And so the kind of cartoonish version of how traditional health impact assessment works looks like this. The people who focus more on atmospheric science and air quality modeling, they produce some usually deterministic model of air pollution across, say, the country. Under some presumed regulatory scenario. So they say there's going to be a regulation, or we have this regulation. We're going to make some assumptions about how that regulation worked in terms of emissions. And then we're going to produce this surface of what we think the air pollution is as a consequence of that regulation. Sort of in parallel to that, we have epidemiologists who are doing, for example, large cohort studies on people where they're measuring the air pollution where people live, and then they're seeing what they get sick with. And they're estimating something like a risk associated with exposure to air pollution in some specific type of study. And the way that traditional health impact assessment works, again, in a little bit of a cartoonish way, is these two outputs from these different red boxes are basically just smashed against each other to indirectly imply some health impact. The atmospheric scientists say, well, we think pollution would have changed this much because of the regulation. And the epidemiologist says, well, if you change pollution by that much, we should have a risk of this in terms of, say, all-cause mortality. And we kind of multiply those things together and we imply what the health impact of the regulation is. And so that is not necessarily a bad way to do health impact assessment, but there are some limitations that I'll highlight because these are precisely the types of limitations that we tried to improve upon with a more, I'd say, data-forward approach to our work, is that that type of health impact assessment relies on risk estimates from previous studies. So somebody will model some air pollution surface, then they'll reach into the literature and they'll pull out some estimated relative risk from some other study. But maybe that study was done in a different population or a different time frame. And so it could be a big assumption to assume that whatever relative risk is pulled from the literature applies in whatever scenario we're interested in. Another feature of this, which I alluded to in our focus on specific sources of the air pollution, is these historical relative risk estimates. They typically estimate the risk of particulate pollution from all sources combined. So they don't distinguish between the parts of the PM that came from, say, power plants or whatever source we're interested in from a regulatory perspective. So what that type of assumption does is it actually assumes that all different types of particulate pollution are equally harmful or equally toxic. And so there's actually mounting evidence to suggest that that's not true. So a PM 2.5 is just a particle of a certain size, but we have this emerging evidence that not all PM 2.5 is created equally. Even though they're all particles of a certain size, they may have different chemical makeups or other different properties that make some of them more harmful to us when we breathe them in. And that's something that the sort of existing technology for health impact assessment really struggled to accommodate. And as a consequence of that, the traditional methods, they really struggle to prioritize or parse health burden that's associated with specific sources or even individual facilities, like it's that factory or it's that power plant that's causing most of the health burden in my neighborhood or something like that. And so these are all things that I invite you to keep in the back of your mind as Lucas goes through his presentation, because these are the things we were trying to improve upon with a more data forward approach. And so again, sticking with this chain of accountability schematic, here's a schematic summary of what we tried to do. And again, Lucas will talk more about this, is that we took actually continuously monitored emissions data at all power plants in the United States to characterize what regulatory actions did to emissions at every power plant in the country. And then we developed what's called a reduced complexity computational air quality model that inputs those emissions and also uses data on wind and other atmospheric conditions to essentially model where the pollution, how the pollution moves through time and space once it leaves a power plant smokestack. And that gave us some characterization of population exposures to the pollution that is specific from coal power plants. And then we combine that with observed health outcomes data and a statistical risk model in order to estimate and characterize the health burden. So we didn't reach into any historical study to obtain some sort of risk estimate. We actually did this all in one go, so to speak, by linking these different pieces of data and computation together. And so the last thing I'll say is that this work is an outgrowth of a broader data science platform that's actually based at the Harvard School of Public Health, but has spread a lot over the years. And actually, Christine, who's on the call, had a hand in some of the early formation of this platform. But there is this platform called the National Studies on Air Pollution and Health, which is really a data infrastructure and data method sharing platform, which has a lot of open source material for data processing, storage, and ensuring reproducibility, a lot of work specific to statistical and machine learning methods development, all oriented towards studies of air pollution and health, and climate and health. And for the purposes of this talk, we made a lot of use of some standardized open source infrastructure for processing Medicare health data. That's public insurance data for people over age 65 in the United States, which is a large task. And then also pulling together other types of supporting data sources that are part of this platform on other exposures, demographics, climate, things like that. So that's really the background, hopefully, to set the stage for Lucas to discuss more specifically some work we've done deploying these types of ideas to estimate the health burden of coal power plants. So I'll stop here and let Lucas take it away.
Great, thanks, Corey. So I will get set up here. Does this look okay? Great. Okay, so Corey gave a really excellent background to the thinking behind the project. And now I'm going to talk about sort of more of the specifics about what we did and what we found in our sort of ongoing studies over the last few years on power plants. First thing I'll say is that Corey and I are here, but we have this kind of awesome team that at one point, many of us were in Boston at Harvard and MIT, but have since sort of spread all over the world, including my student Munshi Razel and Christine Chora, who's at University of Geneva now. Okay, so even just a little bit more background on power plants. So one of the reasons we got interested in them as a source is that they were this major source of air pollution in the United States. So in 2005, for example, they accounted for about 12% of PM 2.5 emissions, 16% of NOx, so that's a different air pollutant, And then, sort of most importantly for this study, 70% of sulfur dioxide emissions, SO2, across the entire United States. So that is really what piqued the interest early on. And other people have done estimates of how many deaths can be linked to power plant emissions or coal power plant emissions. So in this study, let's see, by Irene Deducey, who is one of the co-authors on our study, she sort of took this existing air quality model and did a lot of work and estimated that in 2005 there were 24,000 deaths from coal power plants, and in 2018 that number reduced by about 2/3, with some step in the middle. But Irene's work and other work like this, as Corey suggested, has these major assumptions that we wanted to try to address. So the first is that they're using health risks inferred from previous epidemiology studies. So the population that they're studying isn't necessarily the population that the epidemiology was done on. And the second is that this pollutant PM 2.5 is equally toxic from all sources. And as Corey said, there's mounting evidence that this is in fact not true. There's all kinds of different chemical species in PM 2.5, and what it looks like from different sources is different. And so, we wanted to dig into these assumptions using the data that we had to identify whether these assumptions are reasonable, and if we address them, how these death numbers might change from coal power plants. So coal in the United States, if we looked at all power plants in the United States in 2005, it would look like this. So most facilities are in the eastern half of the United States. And then most of the largest, so the largest are the big orange dots, are in the eastern United States. The Ohio River Valley is here. That gets a lot of attention as sort of coal country. And looking at their emissions over time, so here this bottom plot, the y or the x-axis is time starting in 1999, and the y-axis is SO2 emissions, and you can see this major drop across the period to 2020. So emissions decreased over 95% over this period, and that led us to ask 3 questions. So first, what led to those reduced SO2 emissions and exposure from coal power plants? How have air pollution exposure inequities changed as those SO2 emissions reduced? And then most recently, how's the health burden changed with SO2 emissions reductions? And so I'll start with the first one. We'll come back to this slide a few times to sort of guidepost through the presentation. So Corey showed this plot too, or this sort of graphic too, but it's just giving a sense for how we estimated exposure. So this is just for one facility in 2 different months, February and July in 1999, and we ran this high split model 4 times every day for the entire time period. So this is tens of millions of runs, and did this for every single one of those 480 power plants. We linked this model with a sort of more complex model that would be difficult to run that many times, and estimated an exposure that we call coal PM 2.5. So this is particulate matter that's associated directly with coal SO2 emissions. And after running this model for each individual coal power plant and summarizing the results, we get a plot that looks like this. So this is coal PM 2.5 exposures in every year since 1999 on the zip code level. And you can see towards the beginning, some of the places were exposed up above 8 micrograms per meter cubed. The median was just below 2 micrograms per meter cubed. Keep in mind that the U.S. standard at the moment is 12 micrograms per meter cubed. So at the beginning, this is a major contributor to the air pollution in the United States. And spatially, it looks like this. So as you might expect, there were much higher concentrations in the eastern US where the coal power plants are located. And then over time, as emissions decreased, we saw this decrease in coal PM 2.5 exposure. Now we wanted to dig in a little bit. You could look at this picture and just say, wow, there's been this decrease, but why has there been this decrease? And so we knew something about each individual power plant, both how much it was operating and what emissions control equipment it had installed. And we also knew the exposure from each individual coal power plant. So we could look at how that evolved over time. And that's what I'm showing here. So here, the gray, again, so on the x-axis, we have a time series from 1999 to 2020. And here in gray is the actual exposure. So it's high in 1999. It has this major drop off around the late 2000s, and then by 2020, it's very low. And that exposure comes from two types of plants. One that doesn't have emissions controls, so no SO2 scrubber, and then a smaller fraction comes from facilities that do have scrubbers. On the other side of the plot, we have exposure that didn't happen, or exposure avoided. And that comes from a few different types of sources. So first is retirements avoid exposure. Installing scrubbers avoids exposure. And then reduced operations in facilities. And you can see that this reduced exposure grows over time as more facilities install scrubbers, retire or reduce their operations. And this version is kind of busy, but just to give you an idea of takeaways. So between 2006 and 2011 is when regulations compelled many facilities to install SO2 scrubbers. From 2008, starting with the recession through 2012 and even beyond, is when there was a reduced electricity demand in general in the United States. And so that led to avoided exposure. And then after 2012, mainly linked with natural gas becoming cheaper because of the advent of hydraulic fracturing, coal power plants in the United States began to retire, being replaced by natural gas. And so here, again, we're linking on a facility by facility basis and summarizing it in this sort of single graphic, what's leading to these exposure changes. Okay, the next part of the study has to do with exposure inequities, and environmental justice is rightly becoming a major focus of United States regulatory action. And so we wanted to look at, exposure from these facilities. How is it inequitably or equitably distributed among the US population? And we did it using a population-weighted exposure approach. And this plot is just showing, again, the time series starting 1999 to 2020. And on the y-axis is the population-weighted exposure for these different demographic groups in the United States. And the dots here are the population average. And you can see the white population, which is denoted by the yellow line, really follows that population weighted average. On a nationwide basis, the Black population you can see is exposed at higher levels than the population weighted average. And then all other racial demographic groups here are exposed at lower levels. But this national level picture, again, sort of hides underlying complexity. And since we had the data on individual facilities, we thought we could dig a little bit deeper. And did that and ended up with a plot that looks like this. So here, the two rows, you have the situation in 1999, then the situation in 2020. So thinking there might be some change over time, and then for each racial demographic group here. And what this is showing, so the color of each state is the relative exposure disparity from facilities in that state. And so I won't point out too much here, but you know, one you might notice here is that the Native American population is really highly exposed by facilities in Arizona and New Mexico here, also somewhat Nevada. The Black population, there's a lot of states here in the middle where their facilities are inequitably exposing that demographic group. So another example of how we can use these tools to sort of answer regulatory questions about specific air pollution sources. Okay, and the last piece here is the most recent, is how has the health burden changed with these SO2 emissions reductions? And this is really going to start to get at the types of questions that Corey raised about health and its relation to coal power plant emissions. So again, to remind you that our exposure field looked like this, where we had concentrations in the 0 to 8 microgram per meter cubed range up until about 2007, and then these decreased after that. Most of the exposure was in the eastern United States in the early period. And we linked this exposure to that Medicare data set that Corey introduced, using the sort of most robust statistical methods that we had available to us, and ended up with relative risk for mortality. So the estimates plotted here, so just over 1.5% increased chance of death per 1 microgram per meter cubed increase in PM 2.5, which could be useful on its own, but also useful to compare it to previous estimates. So two of them are here. So one of these risk estimates is taken on the general population. Another one was done in a very comparable analysis on the same population. And what we see is that from our study, this risk of death specific to coal PM 2.5 was over 2 times the risk of death from total PM 2.5 found in these previous studies. So then, having the exposure and having the risk of death and having the exact population that we use to calculate the risk of death, we could next back calculate the total number of deaths associated with coal power plant emissions. And that's what we did in this plot. And so what this is showing, this sort of top band here, are the annual deaths from coal power plants in the United States on the Medicare population. And again, 1995 to 2007, these are very elevated, somewhere between 30,000 and 55,000 per year. In 2007, the emissions drop off after that, and there's this major decrease across the period. If we add up all of these deaths for the whole period, we get 460,000. If we had used the existing models and existing approaches to estimate the number of deaths from coal, we would have gotten much lower numbers. So we would have gotten about half as many deaths from coal power plants if we'd used these previous estimates of risk. And so really highlighting using the exact risk of death from the PM 2.5 from coal allowed us to make better estimates of the numbers of deaths. Again, highlighting the sort of data science-y part of our work, since we had exposures from every single power plant, we were then able to estimate the number of deaths associated with emissions from each power plant. So this is what this plot is showing. Each of the horizontal lines represents one power plant, and the x-axis here is the number of deaths from each of these power plants, and they're organized by region in the United States. So the Keystone plant here, is contributing a huge number of deaths, and many of these other plants are also contributing huge numbers of deaths. The other side of the story, though, is these bars are colored by 4 different colors, and you can see most of these bars are either yellow or orange, meaning that their death contributions are mostly before 2010, before the emissions reductions came in. And very little of the bar is from this later period, very few of the deaths. And I have a different way of showing that on the next slide. The other thing I'll point out is that these major facilities just happen to be in regions that are located near lots of people. So the Midwest East and the Mid-Atlantic are near major population centers like New York City, Washington, D.C. So they have high emissions. There are also lots of people that are exposed to those emissions, and that's what leads to these large death counts. In the West, there's much lower population density, and that's part of what's contributing here to lower deaths associated with facilities in the West. We can use our tools to look at specific power plants. So Bowen is the facility that we showed way early on with the dots that moved around. It's one of historically one of the largest SO2 emission sources in the world. Before about 2005, it was contributing, around 750 deaths per year. They really amped up emissions in 2007. That number jumped to 1,200 deaths per year. In 2008, they installed scrubbers. Major drop in their emissions, major drop in their contributions to deaths, and have been very low ever since. Not zero, but much lower. And you see a similar pattern for the second facility in blue in Alabama. Okay, so this, as Kirsten alluded to, this was just published last week, and we were sort of happy to be covered by a number of different press outlets. It's great to see the work get out there. The last thing I'll finish is what are the results in our findings imply for climate rules and global coal use. Well, the first from a US front is EPA proposed new climate rules for power plants and use some tools to estimate that there would be $85 billion in annual benefits, mostly from reduced air pollution health effects. But our results are suggestive that these estimates that EPA made are likely underestimates. And the second implication I'll raise is that global coal use is projected to increase in coming years. And there was this nice story in the New York Times showing these graphics of increased coal use. And I think our study is really arguing that this is a really bad thing, and we should all be sort of cognizant of that and trying to turn the tide on that. So that's the end of my talk. Thank you, and look forward to the questions.
Thank you so much to both of you. So, since you finished on that, on policy and the implications, so it seems like in the US, for coal plants, it's for now at least it seems solved, which is actually a happy thing. But coal usage in the world is augmenting. Do you know more about facilities around the world, if scrubbers are installed by default, and what's happening there? I have no idea if this is included in your expertise.
It depends on the country. So my knowledge of China is that they're, in building coal plants, but also installing scrubbers for the most part on new ones. Different countries have different rules. I would argue that if a coal plant is needed, then what we're showing is that it's pretty imperative that scrubbers are included to protect health.
Another question, maybe with those models you built, do you think you showed us the nice sort of plumes from the coal facilities? Do you know, or maybe you have plans to, if this can be used to model maybe other pollutants, other measurements, pollutants or other effects, maybe even of climate change?
Yeah, I think especially for air pollutants, I think these types of models can be really useful. And Corey and I have had lots of discussions about balancing model complexity versus scalability. So, our little plot with the moving dots looks really cool, but from an atmospheric chemistry and physics standpoint, it's relatively straightforward and simple. So, we're always trying to balance how complex is it reasonable to make the model to answer the questions that we want to answer, or that we think are useful for regulators.
I can, if I may, I want to add to that. That's right. I mean, I just want to underscore what Lucas said. One of the themes of this work was balancing data and computational scalability against like chemical and physical sophistication. Because some of those incredibly sophisticated air quality models are very good for certain things, but they're not good for doing this modeling of one power plant at a time so that we can isolate these types of exposures. And the main reason they're not good for that is because of they don't scale computationally. And so that's the payoff for doing this modeling that's relatively simplistic. And over the years of work that Lucas outlined, we showed that trade-off was worth it for this problem of coal power plants. We still get an accurate representation of what we want. Whether that happens for other pollutants, I think it could, but we don't know exactly yet. I think that's ongoing. The other thing that I want to say is one of the from a data perspective is one of the important things that needed to be in place for us to be able to do this for power plants was very good data on the emissions from power plants. And so we have that in the United States, and that is almost an accident of how the regulations were written in like the early 2000s in the United States. That was a real benefit of doing this research on coal-fired power plants. Whether one might think of doing something very similar to what we did here with, for example, wildfires. That would be a context where some of the atmospheric modeling and approximations we made might be perfectly appropriate for that, but it's much less straightforward to say what exactly is being emitted by a given wildfire, right? There's not a monitor there measuring that exactly. And so I think that's one of the important things that needs to be in place that really led to the success of this work, is having very rich data on emissions, which is not always available.
Indeed. And you needed that data. Do you think, would it have been possible to act before and to prevent these 500,000 deaths?
That's a very good question. I mean,
Thank
I
Christine.
don't know, Lucas, you might have more informed thoughts on this than I. Like, part of me says, yes, like this could have happened earlier. On the other hand, like the electricity has to come from somewhere. And so, natural gas has not always been as cheap for the reasons related to fracking that Lucas mentioned. Renewable energy technology has not always been so available. And so, maybe some things could have been done on a different timeline, but weighing that against the need to produce electricity is difficult.
Oh, I thought you were going to add something, Lucas. No, you agree.
Yeah, I mean, the other thing I'll say is that we didn't necessarily have the epidemiology health results to sort of argue for this. In the 90s, we were still sort of getting a feel for how bad for us PM 2.5 is. And it's really only been recently that people have sort of shifted to a source-specific thinking. And maybe we're still in that shift.
Since we're here in Switzerland, Europe, do you want to say a few words about the EPA, the Environmental Protection Agency, and how it uses science to make policy decisions?
I can outline that a little bit. There are many ways. I mean, there are scientists who work for the U.S. Environmental Protection Agency, and I can tell you at least one major part of the story of how this science works is the way that regulations are written in the U.S. is there are air quality standards written for different pollutants, PM 2.5 being just one of those pollutants. Every handful of years, by law, the EPA has to review all of the science available to support, indications of health implications of that pollutant. And so the way that works is the EPA puts together this very big report, it's called an integrated science assessment, and it really is that. It's sort of integrating all of the science about whichever pollutant is up for consideration. So the EPA produces that document, draws from a huge literature on say, particulate matter. Then there is a panel of appointed scientific experts called the Clean Air Scientific Advisory Committee. This is what Kirsten mentioned in her introduction, because in the most recent evaluation of these standards in the US, I had a role on one of these subcommittees from that Clean Air Scientific Advisory Committee. But the role of that committee then is to review all of the science that the EPA has reviewed. That committee reviews that report, and then offers some advice basically to the administrator of the EPA that then makes a decision about whether the current air quality standard is sufficient to protect health and welfare. And so there is this loop. I mean, people, like Lucas, like me, and others, they write these papers. The EPA does use them. I mean, they do go into this science, they get vetted, they get evaluated, and they get integrated into the recommendations that EPA scientists and then this Clean Air Scientific Advisory Committee make. There's a political undercurrent to all of this as to whether the decisions that are made, they can use that science to varying degrees, I'll say. But the law is written in the US so that science is there, interwoven in the sort of public deliberation about these regulations.
Thank you. And how can and should data science inform policymaking? And maybe here, are we talking causation or association?
That's a good question. So again, sorry to jump in on this, Lucas, but just to follow on those comments on this Clean Air Scientific Advisory Committee, in the recent history of that committee, causal inference, quote unquote, causal modeling or causality has been one of the main sticking points to say whether all this science we have, is it actually proving something related to causation? And from a data science perspective, the data science methodologies coming from computer science, statistics, epidemiology, econometrics, any of these data science disciplines that are specifically oriented towards causal inference, these are coming to the forefront in the air pollution regulation. These are becoming more and more important. This is data science. You know, how to take all these data on millions of people, on pollution measured across huge spatial domains, you know, national studies, and extract associations that we believe can be interpreted as causal. And so I wouldn't go so far as to say there's a revolution happening in how this works, but I think this type of methodology, which is increasing in popularity across data science domains, is also increasing specifically in these considerations of air pollution studies that are used for regulation.
I might jump in too that there's been a little bit of a weaponization, might be too strong of a word, of the word causal, where if you're not doing using quote unquote causal statistical methods, then your results aren't valid and they don't sort of prove anything about air pollution. And I think that is sort of worrying because there's a lot of evidence out there. And Corey talks about this a lot. There's a lot of evidence out there, you know, using more traditional methods, and we shouldn't just throw that out because there are these new methods that might be, called causal. And so it's worth paying attention to what the actual evidence is versus what the language around it is saying.
Thank you. So maybe just as a last one, I guess you thought a lot about confoundings. How did you address that? Compounding factors, and maybe you're not related to that. If the Medicare database, is that all people or most people over 65?
It's most people in the it's at least over 90% is my impression of people over 95 in the US. And we included lots of confounding variables in our statistical analysis, like data on race, income, smoking status. We did a number of sensitivity analyses including different pollutants in our analysis, and everything was robust to that. I will say that on the epidemiology side, at least my goal was to innovate as little as possible. So we used the framework that Corey mentioned at National Studies of Air Pollution and Health, and used exactly the data that they had used in previous total PM 2.5 studies, exactly the epidemiological statistical model in those studies. And those had been developed really to control for confounding in as fully as possible.
Thank you. Corey, last word. Lucas?
I don't know if I have a last word other than thank you for giving us a chance to come share some of this work.
I would like to thank you for making time, for joining us from the West. And I think for Europe and the energy crisis we're probably going through, this is a paper that everyone should read, or at least the short version and other news outlets. Thank you very, very much for your presentation, for these insights. And I wish you a good day. It's starting for you. And thank you to our listeners.
Thank you.
Thanks so much.